my name is Iris Angeli Mallorca from BSN 1Y3 and 7A. Today we're going to do a return demonstration about bed batting, shampooing, oral care, and back massage. First, we need to do the bed batting. First, review the chart for any limitation in physical activity. Second, bring the necessary equipment to the bedside stand over the table. Cloth, towel, cotton, clean gloves, trash bag, and alcohol. Third, perform hand hygiene. Next, identify the patient, discuss procedure with the patient. Good morning, sir. My name is Iris Angeli Mallorca, your nurse for today. May I know your name,
Isaac Ricarda,
your age,
9,
and your birthday?
May 22, 2016.
Thank you, sir. Next, close the curtain around the bed and close the door to the room. If possible, adjust the room temperature if necessary. Remove the sequential compression devices and entrabulism stockings from the lower extremities according to agency protocol. Offer patient bedpan or urinal. Adjust the bed to the comfortable working height, usually elbow height of the caregiver. Put on gloves, lower side, real nearer to you, and assist patient to side of bed. You will work, have patient lie on his or her back. Next, loosen top cover and remove all except the top sheet. Place the bath blanket over the patient and then remove top sheet while patient hold the bath blanket in place. Fold it over the chair, place soiled linen laundry bag. Take care to prevent linen from coming in the contact with the clothing. Next, remove the patient gown and keep bath blanket in the place. Raise side rails, fill basin with the sufficient amount of comfortably warm water. Add the skin cleanser if appropriation according to manufacturer direction. Put on gloves. If necessary, fold the washcloth like a mitt on your hand so that there are no loose ends. Lay a towel across the patient chest on the top of the bath blanket. Next, with no cleanser on the washcloth, wipes on eye from the inner part of the eye near the nose to the outer part. Wrist on the turn the cloth before washing to the other eye. But patient face, neck, and ears apply the appropriate emollient. Expose the patient for arm and place towel lengthwise under it using the firm strokes. Hi everyone, my name is Iris Angeline Mallorca from BSN 1Y3M7A. Today, I will be going to do return demonstration. Today, return demonstration is about bed shampoo. Before we start, make sure to provide the client privacy and wash your hands. Today, I'm going to assist you in shampooing your hair. First, we need to wear our gloves and going to ask your patient if they need pillow under arm. You want pillow, sir?
No.
Next, so now we're going to roll the trash bag if you don't have a rubber sheet. And the towel to make sure that the trash bag in the underneath the towel. Next, you are to inspect our condition of the hair and scalp of our patient and check there any inflammation. Next, we're going to mix and hot and cold water with temperature of approximately 42 and 44 degrees Celsius. We're going to use of elbow to the test. Using the water, pour the water over the head for patient until it's completely. After, we are going to mix the water and the shampoo in the basin. We're going to put in the hair of our patient. After lathering your hair with both hands, we're going to start at the hairline and go to the nape of the neck, and we're going to the massage of the scalp and applying pressure with your fingertips. Next, then after, we're going to rinse until the shampoo is completely removed. Next, remove the cotton balls in the ears of the patient. And after that, we're going to use a dry towel, wrap the hair of our patient and dry it, and we're going to remove the damp cloth and the pass of patient face dry, and we're going to comb her hair. Next, Then we will remove the towel and I will position the patient in the comfortable position. Good morning, sir. Today we're going to do a proper oral care. Remember, keeping your mouth clean and healthy is a very important. Gather all necessary equipment, toothbrush, gloves, and toothpaste. Next, perform hand hygiene and put PPE if indicated. First, you need to use small-headed, medium texture Tristel toothbrush with a small amount of fluoride toothpaste. Next, start by tickling the toothbrush against your teeth so that bristles are the 45 degrees off to the gum line. Next, brush the outer surface each tooth, keeping the bristle angle against the gum line. To do is the same thing for the inside surface of teeth. Next, now, brush the breathing surface of the teeth on the top and the bottom. Next, to clean the inside surface of the front teeth, till the brush vertically at the upper teeth. For the lower teeth, the brush vertical in a few seconds. This one. And after that, spit out of remaining toothpaste to do not rinse the mouth with water or any kind of mouthwash because the fluoride in the toothpaste will help to protect the teeth. Next, we're going to return demonstration is about back massage. Before proceeding to do the procedure or to the patient, we need to prepare the things we are going to need and also proper hand hygiene. And as nurse, we need to consider the patient request if it's the for lotion, oils, or powder. After doing those things, we now proceed to the patient. So, sir, you are scheduled for today, back massage. So, for today, back massage, I have prepared powder, lotion, and all. You may choose what do you want.
Powder.
Okay. Before we proceed the procedure, position the patient from the supine position to the prone position. So after the rubbing the powder, we need to start from the area upward. You are going to do an affleurage, which is the long and light stroke that warm up on the body. After doing the affleurage, you are going to do the massage movement, the spertissage. A massage movement that uses pressure that has deep compression of underlying muscle.
Sige po. Ayan. I-mute mo na yung video. Next na.
So, after doing the movement, you may proceed to the tapotment, which is the rapid of repeated striking of the body. So, after doing those steps, you may now position the patient from the prone position to supine position. Hi everyone, my name is Iris Angeli Mallorca from BSN 1Y3 and 7A. Today, we're going to do a return demonstration about transferring the patients into the bed to chair and chair to bed. Next, review the medical record and nursing plan of the care for condition that may influence by patient's ability to move or to be positioned. Assess for tubes, IV lines, incisions, or equipment that may alter the positioning procedure. Identify any movement limitations. Consult the patient handling algorithm if available to plan appropriate approach to moving the patient. Perform hand hygiene and put on PPE if indicated. Okay, next, identify the patient. Explain the procedure to the patient. Okay, sir, good morning. My name is Iris Angeli Mallorca. Your nurse for today. May I know your name,
Jolo Di Castro.
your age,
9.
and your birthday, sir?
December 12, 2015.
Okay, sir, thank you. Next, if needed, move equipment to make room for the chair. Close the curtains around bed and close the door to the room if possible. Place the bed into the lowest position, raise the head for the bed, and sitting position or high as the patient can tolerate. Next, make sure the bed brakes are locked. Put the chair next to the bed. If available, lock the brakes of the chair if the chair does not have brakes. Brace the chair against the secure object. Next, encourage the patient to make use of the stand assist aid, either the freestanding and attached to the side of bed, if available, to move to the side of the bed and the side lying position, facing the side of the bed on which the patient will sit. Lower the side rail if necessary, and stand near the patient hips. Stand with your legs shoulder width apart with 1 foot near the head of the bed, slightly in front of the other foot. Encourage the patient to make use of the stand assist device. Assist the patient to sit up on the side of the bed. Next, encourage the patient to make use of the stand assist device. Assist the patient to sit up on the side of the bed. Ask the patient to swing his or her legs over the side of the bed. At the same time, pivot on the back leg in the lift patient trunk and shoulders. Keep your back straight, avoid twisting. And next, stand in front the patient and assess for any balance problems or complaints of dizziness. Allow the patient legs to dangle a few minutes before continuing. Assist the patient to put on a robe as a necessary and non-skid footwear. Wrap the gait belt around the patient's waist based on assessed need of facility policy. And next, stand facing the patient, spread your feet about shoulder width apart and flex your hips and knees. Ask the patient to slide his or her buttocks to the edge of the bed until the feet touch the floor. Position yourself as close as possible to the patient with your foot position on the outside of the patient's foot. If a second staff person is assisting, have him or her assume a similar position. Encourage the patient to make use of the stand assisting device. If necessary, have second staff person grasp gait belts on opposite side. Using the gait belt, assist the position the patient to stand, rock back and forth while counting to 3. On the count of 3, use your legs, not your back, to help raise the patient to standing position. If indicated, brace your front knee against the patient weak extremity as her or she stand. Assess the patient balance and leg strength. If the patient is weak and unsteady, return the patient to the bed. Pivot on your back foot and assist the patient to turn until the patient feels the chair against his or her legs. This action ensures the proper positioning for the sitting. Ask the patient to use arm to steady him or herself on the arm of the chair while slowly lowering of the sitting position. Continue to brace the patient knees with your knees and hold the gait belt. Flex your hips and knees when helping the patient sit in the chair. Assess the patient alignment in the chair. Remove gait belt if the desired depending on the patient comfort. If could be left in the plate to use. Returning to the bed, cover the blanket if the needed. Make sure, call the bell, the other necessary items are within easy reach. And lastly, clean the transfer aids per facility policy if not indicated for single patient use. Remove the gloves and any other PPE if used. Perform hand hygiene. Next, we'll be demonstrating a safe and efficient method for transferring a patient from a chair to a bed. This is the crucial skill for healthcare professionals will be focusing on the patient who has some mobility but requires assistance. Next, review the medical record and nursing plan of the care of condition that may influence the patient's ability to move or to be positioned. Assess for tubes, IV lines, incisions, and or equipment that may alter for positioning procedure. Identify any movement limitation, consult patient handling algorithm if available to plan appropriate approach to moving the patient. Perform hand hygiene and put on PPE as indicated. Next, we assess the patient capabilities. Put on the transfer belt. Remember, if should be the snug but not restrictive, we'll use the belt for the added support and control. We're going to help you, sir. Is it okay with you, sir?
Yes.
Finally, we raise the bedside rail in the check the patient comfort and position. Remember, always assess the patient individual needs and adapt the techniques accordingly. Use assistive devices when necessary and always prioritize safety. Hi everyone, my name is Iris Angeli Mallorca from BSN 1Y3 M7A. Today we're going to do a written demonstration about applying hot and cold compress. First, we need to do a apply hot compress. First, verify the client identity using the 3 identifiers. Good morning, ma'am. My name is Iris Angeli Mallorca, your nurse for today. May I know your name,
I'm Pauline Castro.
age,
I'm 19,
and birthday?
November 17, 2005.
Thank you, ma'am. Next, verify the order for type of moist heat, application, location and duration, and desired temperature. Review the client chart for medical history and contraindications that may prohibit that use of hot or warm therapy. Assess the client's skin around the area to be treated and the client's temperature and the pain sensitivity. Next, inspect the wound of any for size, color, odor, and tenderness and drainage. Next, perform the hand hygiene and apply the clean gloves. Place a towel or the absorbent pad under the area you will treat. Next, apply the heat compress to the affected area molded over the side. Next, stop the application immediately if any untoward incident for problem occur. Next, inspect the body part of the wound condition for evidence of effectiveness of the therapy and sensitivity to touch. Next, ask the client to describe level of comfort and burning sensation following end treatment. Are you comfortable, ma'am? Next, obtain the vital signs and the compare with baseline. Next, identify the expected outcomes. And lastly, document and report all pertinent information of the procedure performed. Next, we proceed to the cold compress. Assess the client's skin around the area to be treated and the client temperature and the pain sensitivity. Next, inspect the wound if any do, size, color, odor, tenderness, and drainage. Next, assess the client and the family awareness, understanding of the procedure, and the related safety factors. Identify the expected outcomes, assemble and prepare the equipment and supplies needed. Okay, ma'am, we have a towel, ice, alcohol, and clean gloves. Next, explain the procedure to the client clearly and completely with the client approval. Next, describe the sensation patient would feel, percussion to prevent friction and the numbness. Provide privacy at all times. Position the patient in the bed, keep affected body part in the proper alignment, expose the body part to be covered, drop patient as needed. Next, perform the hand hygiene and apply the clean gloves. Place a waterproof pad or towel under the client body part if appropriate. Submerge the gas pad or the towel into the water and wring out excess moisture. Next, apply the compress to the affected area or molded over the site. Next, remove, remoisten, and reapply to maintain the cold temperature as needed if necessary. Check the skin condition at the appropriate and regular intervals. Next, stop the application immediately if any untoward incident or the problem occur. Next, remove the gloves, dispose of properly, and perform hand hygiene. And next, help client to a comfortable position. Remove, clean, dry, and store or dispose of supplies and equipment accordingly. Inspect the body part of the wound condition for evidence of the effectiveness and therapy and sensitivity to touch. Next, ask the client to the described level of comfortable. Are you comfortable, ma'am? Okay, thank you. Next, identify the unexpected outcomes. And lastly, document and report all pertinent information of the procedure performed.